Good afternoon, everyone. I'm Dr. Abhisekh, and today I'm here to present multiple sclerosis. I was supposed to present a case that came to our OPD, but my sincere apologies, I couldn't really gather the history of the patient, so I'm just presenting it generally about the multiple sclerosis. To start with, it's an autoimmune disease that damages the insulating myelin sheath of the CNS. Talking about epidemiology, the onset age is from 16 to 60 age groups, and it peaks at the age of 30. It's more common in women at the ratio of 3:1, and it's one of the most common causes of disability in younger adults. The etiology is the genetic factor, the female age groups, environmental factors, and talking about the descent, the Northern European Caucasian descents are more prone to this condition. And infections like measles, mumps, rubella, and Epstein-Barr virus, and also vitamin D deficiencies may also cause this multiple sclerosis. The pathophysiology here is that any infection that breaches the blood-brain barrier and invasion into the spinal cord or the brain, which causes the loss of the myelin sheath and causing the breakdown of the insulation around the axons, due to which the conduction velocity across the axons is deranged and is ultimately blocked. This is the pictorial representation of the pathophysiology of MS. Talking about the symptoms, this condition has a wide variety of symptoms as it can affect the various parts of the central nervous system. The most common symptoms might be like numbness, weakness, electric-like sensation, in which we find the Hermit signs to be positive, in which the electric-like sensation is felt when the neck, the head of the patient is flexed down. Likewise, tremor and lack of coordination. A patient may also complain of unsteady gaits, and some patient might also have problems with their vision, with partial or complete loss of vision, double vision, or blurred vision. Likewise, fatigue, dizziness, tingling, and speech problem is also associated with this condition. Talking about the types of MS, the clinically isolated syndrome is one of the types in which it's called the first episode of the neurological symptoms, and as per the criteria, it must last for at least 24 hours, and we can say that it's just the beginning of the MS, and it's not mandatory that every patient with CIS will go on to have MS. So a patient can only be restricted to clinical isolation syndrome. The other types are the relapsing remitting MS, which is the most common type. Likewise, the secondary progressive and the primary progressive MS are the other types of the MS. If we talk about the relapsing remitting, which is the most common type, we find that there is this relapse of the symptoms in which a patient has, after some times, the patient has a little or no symptoms at all. And likewise, in secondary progressive, the onset is same as that of the relapsing remitting, but the symptoms gradually progresses. And in primary progressive, there is progression of the symptoms right from the onset. Now talking about the diagnosis. Talking about the diagnosis, if we talk about the diagnosis, the damage in the criteria, we have the McDonald's criteria for the MS, in which the clinical symptoms, the time of the attacks, and the other additional findings they come in picture. In this criteria, like if we have 2 or more attacks and if we find 2 or more lesions in the MRIs, then it's one of the criteria for having MS. Likewise, 2 or more attacks with 1 lesions in the MRI, and dissemination in space in MR is the other criteria. Likewise, single attack with 2 lesions and in different time intervals is also the other criteria. And likewise the 1 attack with 1 lesions with dissemination in space and time, which means that there is a lesion in the MRI and the symptoms occur in 2 different times. Then it's also one of the criteria for the diagnosis of multiple sclerosis. The other test that helps to diagnose multiple sclerosis is blood tests, in which we basically try to rule out the other disease, other conditions that mimic the symptoms of this multiple sclerosis. Likewise, the spinal tap, the lumbar puncture, in which we look for the oligoclonal bands. In the MRIs, we can see the areas of demyelination around the corpus callosum, the ventricles, in the white matters. And likewise, the evoked potential, in which we find the stimulation to be less active. The treatment is can be classified into different topics, like symptomatic treatment, in which the symptoms like the um, bladder dysfunctions, the tingling, numbness, the pain, also the cognitive disorders are treated symptomatically. And likewise, the acute relapse cases are treated with high dose of IV methylprednisolone. And different disease-modifying therapies have been coming up in recent researches as well. The most recent being the ponesimod, the Ponvory, which was recently approved by the FDA, which mainly reduces the relapse and the brain lesions in adult patients. Likewise, the other is the autologous hematopoietic stem cell transplantation. And after the patient receives all this, if he has some remaining like this symptoms, then physiotherapy and rehabilitation is also given to the patient. So to conclude, in summary, it's a chronic autoimmune condition which affects the younger adults, and it's more found in the women. It's a condition which is difficult to diagnose, in the sense that it has wide variety of symptoms, and it mimics, and the other condition also mimics the symptoms related to this. It involves relapse and remission of the symptoms. There are different disease-modifying therapies for MS, and newer therapies are also being are under research for the remyelination and neurodegeneration, which targets remyelination and neurodegeneration of the neurodegeneration. So this is basically a condition in which the therapies, newer modalities of treatment are being studied and are under research. So thank you.